Many people believe that once your uterus is removed, are safe from uterine diseases. But that is not entirely true. Uterine-related diseases can still occur even after hysterectomy or when the uterus is absent. Learn the science, the symptoms to watch for, and how to protect your reproductive health. Welcome back to my channel, and today we are diving into a topic that surprises a lot of people. You don't need a uterus to get a uterine disease, right? That sounds strange, but it is true. So, if you have had a hysterectomy, that is surgical removal of uterus, or you are just curious how the female reproductive system works, stay tuned. This will help you to understand your body better. Now, I want to make you to understand that this surgical removal of the uterus comes in many types. Basically, we have three types. We have the sub-hysterectomy, which in this case, the uterus is removed, but the cervix remains. We have two. We have total hysterectomy, where the uterus and the cervix are completely removed. We have radical hysterectomy. Here, the uterus, the fallopian tubes, and the cervix, and the fallopian and the surrounding tissues and lymph nodes are removed. In today's video, we are discussing something that shocks a lot of women. You don't need a uterus to get a uterine disease. By the end of this video, you will understand three basic things. 1. Why uterine diseases can still occur after the uterus is removed. 2. The symptoms to watch for even if you have had a hysterectomy. 3. What you can do to protect your health and prevent complications. So, relax. Let's get into the video. Many women assume that after hysterectomy, they are completely safe from uterine or pelvic problem. But that is a dangerous misconception. Watching this video to the end will help you to know the signs, protect your reproductive system, and possibly save a life, maybe even your own life. Now, we are going to look at part 1 of this video, understanding what the uterus is all about. Let's start with the basic. The uterus is a muscular organ where the baby grows during pregnancy, but it is also closely connected to other structures like the cervix, the vagina, the fallopian tube, and the ovaries. Even after hysterectomy, where the uterus is removed, some of these structures can still remain and develop diseases that can get to uterine issues, related issues. Part 2, why uterus diseases can still occur even after hysterectomy. How is it possible to get it without the uterus? It's a good question, right? Okay. The answer lies in the cells of the tissue that once surrounds them or connected to it. Soft endometrial cells can remain after surgery and continue to grow and cause endometriosis. What is endometriosis? Endometriosis is a condition in which cells similar to the lining of the uterus, grow outside the uterus. This definition is according to Mayo Clinic. Now, point number 2, why you can have a uterine diseases without having the uterus. Now, cervical cancer can even reproduce these symptoms. 2, hormonal imbalances can trigger even bleeding. 4, sometimes ovarian tumors or pelvic infections affect nearby tissues. Part 3 of this video, common symptoms to watch out for. If you don't longer have the uterus, that doesn't mean you can ignore certain symptoms or manifestations. It is very important to watch out these 5 manifestations, which may signal a disease-related concern. 1, unusual pelvic pain. 2, vaginal bleeding or discharge. 3, distension, swelling or enlargement or pressure. 4, pain during intercourse. The last but not the least, fatigue or unexplained weight changes. This may not mean something serious, but definitely it is very important to see a healthcare provider. Now, how can we prevent these uterine diseases or uterine-related conditions? Prevention starts with awareness. These are the 4 main things that will help. 1, keep up with your gynecological checkups after hysterectomy. 2, know your family history of cancer or hormonal diseases. 3, maintain a healthy diet and body weight. 4, report new symptoms early. Remember, your reproductive health does not end when your uterus is removed. Of course, your body still needs care. To encourage you and empower you, remember, your uterus doesn't define your womanhood. Whether you have it or not, you still deserve weapons. Now, I would love to hear from you. This video teaches you something new. Comment below and share your thoughts or your questions. Your experience may help another woman. If you find this video helpful, check our next video in the description box. We will be bringing more elderly tips, more health-related videos concerning elderly, which you will enjoy watching. To recap, you don't need a uterus to get a uterine disease because your health depends on your entire system, not just one organ. Thanks for watching. Stay informed and see you in my next video.